Are we on? Okay, welcome to the normally scheduled public safety meeting of Monday, March 20th, 2023. I'd like to call to order that meeting now, and we will start with if there is a motion for approval of minutes for the last meeting of February 21st, 2023.
So moved.
Second? All
Aye.
in favor? Aye.
Mr. Acting Chair, I'd like to make a motion to amend the agenda. I move that we take item 6, which is new business, the report from the Central Connecticut Health District, and move that up to right now.
Second? All in favor?
Aye.
Aye. Charlie, you're on.
Okay, thank you very much. You make it short and sweet today. Total cases right now as of the 16th of March is for Rocky Hills 5,280 cases. We now stand at 157 fatalities. Current positivity rate in Rocky Hill is 7.1%, which is the highest that we have among our 4 towns. But is by many measures, it's a lot lower than we've had in the past. Numbers generally are decreasing. All counties in the state of Connecticut are currently in the green, according to CDC's transmission scale. So the numbers have really been heading in the right direction, and we hope that, once again, we're heading towards seasonality with respect to COVID-19 and seeing more similar patterns to what we see with seasonal flu. With that, I stand ready to answer any questions.
Any questions?
No questions, Charlie. Thank you.
Charlie, that was good. So any forthcoming issues for the summer or like spring and summer, anything you're looking at, apart from COVID, anything there?
Yeah, we're still keeping an eye on highly pathogenic avian influenza. There's been one human case in the United States. It was a poultry worker, but as we're starting to see, seasonal migration of birds, the potential for spread of that particular disease exists. Most of the risk, has to do with backyard poultry flocks, but we are watching that particular disease as well.
Thank you, Charlie. So moving on to our departmental updates, we'll start with fire. Chief Gary.
Thank you, sir. Go over the highlights of the monthly report first. We had a busy month in February. We had 71 incidents. I know you folks were at a few of them. Year-to-date was 121 at the beginning of March. We're up to, I want to say, 155 as of today. Training hours recorded, our year-to-date was 892, which was well above the 669 for this point last year. 0 injuries reported. We have an average of 15 firefighters per station and 10 in the staff. And all staff assigned individuals are required to act as firefighters if the situation calls for it. So that supplements the stations. We have some leave of absences, 2 on admin. That's actually down to 1. And 2 military leaves and 2 medical leaves. We put on 1 new member, year-to-date 2. Next month we'll report we put on an additional 2. So with all the numbers added up and everything, we're at 57 active this month. Okay, I'm going to hit on some of the facilities and quartermaster stuff in a few seconds here. Public information was very busy. It's listed in the report. The training report I'm going to hit a little bit shortly, but I do want to mention that in-service training was provided to all the membership on the use of the Bluetooth integration with the radios into the Scott Packs, meaning prior to this, when you talked on the radio while you were in an air pack, the cone or the face piece would mask some of the words or some of the transmission. Now all you have to do is click on your radio, talk normally, and there's a Bluetooth feature in the mask that talks to the radio. We've used it, and it really works out well. Last month, we had a little drone presentation, and we thank you for allowing us to do that. And there were 3 drone call-outs last month, and 23 limited access highway forums or highway calls were billed for a total of 11,500. I'm going to go into that a little bit more very, very shortly. We also did provide the incident summary report for the 71 calls. It talks about 3 building fires, okay? One was in Rocky Hill, and we were called to Cromwell for one and Weathersfield for one. Just the way the NFIRS report is written, it's a federal report. It doesn't go into that much detail. So I just wanted to point that out. A couple other things. I'd like to thank the council for attending the department's awards night, and as well as the Jim Lamar Remembrance Ceremony last week. Our limited access highway reimbursement program is going well with a total as of today of $76,500. I also understand it's not funded in the new budget, so we're working on that. We desperately need that funded. We did have a very busy month with training for February with 4 regularly scheduled drills. A couple of highlights. We started to drill in our acquired structure at 295 New Britain Avenue. We're focusing on firefighter safety and survival, specifically how to recognize the signs of trouble, how not to get lost or trapped, and lastly, if you do, how to survive in a IDLH, which is immediately dangerous to life and health environment. We've trained on the new hydrant valves, which we have placed in service. These will increase our efficiency at scenes. Also, an added bonus, they will provide additional water and water pressure, as their friction loss profile is considerably less than what we're using now. We've been spending a lot of time, and you'll hear about this a little further down, on manpower-based tactics as we see a little downflux in our census. We placed in service new lightweight 2-inch high-rise standpipe hose, which replaced the traditional 2.5-inch hose bundles. In this case, we're able to increase our efficiency while maintaining a comparable flow rate. Bottom line is that setup requires less manpower to place in action. For the past several months, I've been mentioning officer training, and the goal is to ensure officers and future leaders are receiving supervisory management training, both for fireground tactics and also department management, leadership on and off the fireground. About a month ago, February 19th, we were called to a single-family residence for a reported window flower box fire, which the homeowner had extinguished. And he wanted us to look at a small amount of smoke in the house. When we got there, we had a great deal of smoke in the home and a working fire in the attic. After removing the home's occupants, the crews were able to rapidly locate, confine, and extinguish the fire. And this is exactly the situation we've been training for. So it really paid off. Sat back looking at that almost as if it was the final exam for a lot of those topics. Continuing with training, 2 members are enrolled in Firefighter 1 certification, 4 members in Firefighter 2 certification. The difference being Firefighter 1s can work under direct supervision. Firefighter 2 can be those supervisors. We also have 2 members in a 2Q driver operator training. 2Q is the endorsement DMV requires to operate fire apparatus. This will bring us up to about 99% in terms of certified firefighters. From the quartermaster area, we received a formal interpretation from the National Fire Protection Association in conjunction with OSHA, and they have determined that the service life of our helmets is 10 years. Prior to that, as long as they passed inspection, they were good. We're going to be looking to replace 32 helmets. Some of these helmets we've had in service since 1997. So we're adding the cost of the helmet into into one of the rounds of gear replacement. But I guess the little silver lining there is there'll be some upfront costs, but we'll no longer be rebuilding the helmets. So we'll save costs on the rebuild for the life there. Another thing we came across was our rescue airbags are over 10 years old. When we bought them from Paratech, which is the manufacturer, there was an accepted testing procedure in place which would allow us to extend the service life of the airbags as long as they successfully pass the test. Paratech no longer recognizes that testing procedure, probably to sell more airbags, I would think. But we had to remove the airbags from engines 1 and 2, and we've ordered the replacements for the airbags on Rescue 3. We're going to keep those in service, and we expect a delivery on those in August. And before I wrap up, I'd just like to touch on incident response for a few minutes. Since January 1st, we've had over 150 calls, which is just shy of 15% greater than we were last year. We're averaging about 17 firefighters per call, which sometimes is a little misleading because we do have a number of single or two company calls. The membership has about 2,480 individual responses, and that's a lot of time leaving their houses. We've had several incidents worth mentioning lately, one being the Charter Road fire. The second one was a carbon monoxide incident at 400 Cold Springs, which occurred on March 7th at about 10 o'clock in the morning. We got a call for a report of an activated carbon monoxide detector in a third-floor apartment. The apartments are only required to have smoke detectors, so this was a self-bought detector, carbon monoxide detector. As our first officer entered the building, and we have our handheld meters, he had very high readings in the lobby and even higher readings as he started moving over towards the elevators. He activated the fire alarm, backed out, called for more assistance. We treated this as what it actually was, it was a hazardous material call. We knew we needed a lot of help. We brought in Task Force 51, which includes the towns of Cromwell, Berlin, Newington, and Wethersfield. EMS was there. They brought in, I want to say, 4 ambulances and several supervisors. Brian was there. Our first priority was to evacuate the building. We did so by performing a primary and secondary search, but we're still finding people in the apartments 30 minutes later. One in particular who had high readings in her apartment. To block out the fire alarm, she put in her earbuds and was watching TV, a little louder than normal. We discovered the highest concentration of carbon monoxide in the areas adjacent, in the areas and apartments adjacent to the trash chutes and elevators. As we're conducting the search, getting people out, we're also looking for the cause. And it turns out the on-site boiler company had done some work earlier in the day, and the results caused the exhaust from the gas boilers to be redirected and vented into the building. The exhaust then found its way into the vertical shafts, which are the elevator shafts and the trash chutes, and then into the living areas. No exaggeration here. all the parts were in place for a catastrophic event, but that CO detector in apartment 308 did its job. Probably the best $30 that was ever spent. So that incident was about 3 hours long. We were able to get everybody back in. We had some help from the state boiler inspector came up there. That wasn't a pretty conversation between him and the boiler people from Concierge. With that, that's what I have tonight.
So, Chief, the carbon monoxide incident, I mean, that's very unnerving. It's just the happenstance that some tenants happen to spend their own money to install their own detector, and that's what alerted them and their neighbors. Do you know if there are, so I take it from that, there's no requirement in this town that multifamily houses, apartments, condos, whatever, have CO detectors?
I don't believe there is. I don't believe there is in apartments and attached to, connected to fire alarm systems.
So do you know if any towns require that, or if that's a thing, anywhere? And I know that can be a mixed blessing because of your potential for false
I'd almost
alarms.
want to direct that to the fire marshal's office. I do know that daycares are required, and believe it or not, parking garages are required. I'm not sure residential at this point, other than possibly new houses. I would direct the final answer to the fire marshal on that one, but everything was in place for something catastrophic, and again, that $30, first alert saved a lot of people.
So is that information we can have for our next public safety meeting, either through you or Steve or somebody? I'd just be interested in knowing, again, if Rocky Hill is typical or not in not having that type of requirement. I'd just be interested in knowing, what the current state of the art is on that, or the current thinking as to whether that's something to consider.
I'll send an email to the fire marshal's office, and pretty sure we can probably get an answer fairly quickly, and then maybe even put it with the minutes, Mr. Manager.
I mean, even if not in every unit, but at least in the common areas, hallway, something like, it'd just be interesting to hear what other towns are.
It was,
are doing.
I would like to know also, absolutely.
Okay, thanks.
Thank you.
Yeah, no, that was well in time response, I guess, because it could have just devolved into something really hard. I think I had the same question about something systemic, but I don't know if there is anything systemic related to code violation or anything like that. But if it was just a incident, solitary individual.
Well,
incident.
I'll tell you what, the fire marshal's office is on top of the codes and so forth. And I can also tell you we don't receive carbon monoxide alarms from the other apartment complexes, which leads me to believe they're not required. I would ask him to check the code and see if he can give us a definitive answer on that.
No. Thank you, Chief.
You're welcome.
So with that, we'll move to ambulance.
Rocky Hill, we had a total of 376 calls for the month of February, which brings our total up to 753 for the year so far. We had 11 canceled calls. We had 1 no contact. We had 2 that we were canceled before getting there. We had 5 lift assists for the month and 4 people who refused transport. We didn't have any opioid-related transports. We did have 2 cardiac arrests for the month of February. We had 67 hours of training for the month of February. Patient assessment and CPR were the training classes. We're currently about a month into our current EMT class. We have 6 people in there. Things are going very well with that. Possibly 6 new riding members are going to come out of that. Also, we started this last month. The first Tuesday of every month, between 12:30 and 1:30, we go to the community center with the seniors. We do vital signs and blood pressures for the seniors, any kind of medical questions or issues that they would have any questions for us. And we also fill out the Vials of Life with them, and that's the small little form that they fill out with their name and medical stuff, and they put it on the refrigerator. If we happen to go to a medical call and they're unable to communicate with us, we have a current list of their medications and their history and allergies and basically right down to like what hospital they want to go to. So if they have a preference of which hospital they want to go to. Let's see. We have, like I said, 39 riding members. We have 6 that are not associate members. We have 10 probationary members, with 2 of them possibly getting cleared shortly. We have 2 on medical leave, and we have 4 that are still at college. And that's about it for the month, for this month.
Sorry, Councilor Sullivan.
No questions. Thanks, Brian.
So I did see like a survey somewhere in the packet.
I have no idea. That came from Aetna. That was new to us, too. I have no idea what the surveys are for.
When Aetna, they started sending me their stats, and with the stats came pages of surveys. I guess they take surveys.
Is that data available? I guess that's the follow-up question on that, right? I mean,
Again,
I think that was just a questionnaire, I think.
Yeah, it doesn't come, we get plenty of letters of, thank you, correspondence that we get every month from the ambulance and stuff like that, but that was the first I've seen Aetna. I mean, I used to work for them, and they along with their bill and everything, they always send a questionnaire if there's anything they could do to improve or anything, but it's the first time that it's ever been included in the report, because we've never kept track of that, as far as I know, for.
Sure. Can we check if they keep any data on that? Like, did they actually like tabulate those surveys? I mean, I'm not sure like even how much they will be getting back probably from a response rate perspective, but it's good to have, if they have an instrument like that, then you should make use of it, right? I mean, I know it's not complete, but.
Right, but I mean, they should send it to me, and then.
Sure, I
Right,
agree,
And then
yeah.
I'll be able to, go through that route. I mean, because the PSA goes through us. If there's any complaints from them, then we handle it through with Aetna as the R5 holder. And
Right.
then we correct the problem and, and that kind of an issue. But, the Ambulance Association is responsible for all that kind of stuff, so.
So what
take it.
if they sent it to you, you would tabulate the information?
I could, if they wanted it included. We've never, nobody's ever asked for the satisfactory stuff, you know what I mean? We can completely add that to the list if that's something that you guys, they send it with every bill that they get, that they send out for their patients, so, if you look at the calls that, so they had a total of 278 for last month. So every time that they did a call and they did a response and they went and then they billed for the call, they should have 200. They send out with the bill those things. Whether they get 5 or 6 of them back, or I you know what I mean?
Yeah, I'm
We
just
have no
curious how
idea.
much they get back, like how many of them, I
Yeah,
guess.
we have no idea.
Yeah, so if they, I mean, I guess we can figure that out, between you. If they send it to you and it's send it to like the town manager as well, I guess you can
yeah.
tabulate it.
I can find out. I can call them and ask them what it's all about, and if they keep those statistics or not. I have no idea.
Okay.
All right.
And so the number of calls Aetna did was 278 for the month? Is that what you said?
Yeah, that's what it says total, I think. Let me
Okay.
find
We
exact number.
did 98 for the month, and they did 278 for the
78.
month,
Okay.
meaning equaling 376.
Yep.
And last year in the same time, we did 101, and we did 98 this time. They only did 204 last year, and this year they did 278. So
Yeah.
the numbers, you have last year's results.
Yeah,
also,
I
and-
saw that. It's about like 30% or something,
Yeah.
33%.
So Aetna would send out 278 surveys if they
Every
did?
time that they send a bill, they would send it's included in their,
It's a lot of
how can we do
surveys.
better type of a thing, you know what I mean? It's,
Yeah.
that was something that they,
Yeah, I'm sure the response rate is not great on those things probably unless they follow up. But,
right,
But it's worth checking, I guess.
yeah.
All right. Thank you. Going to police. Chief Custer.
Yes, sir. Okay. For the month of February, there were 3,050 calls through the Emergency Dispatch Center. We had 29 criminal arrests for the month. We investigated 40 motor vehicle accidents. 5 were involved with injuries. The remaining 35 were just property damage only. We had 3 DUI arrests for the month. Officers issued 85 infraction tickets and an additional 167 warnings for a total of 252 motor vehicle contacts for the month. And our training hours were 99 hours for February. We mentioned last meeting about tracking training specifically in the area of de-escalation and dealing with individuals with mental illness. There were no such training hours for February, and again, it will be dependent on the training that we have scheduled for the month. We have a matrix for the year, but I do want to note that we did receive it in the month of January. Of the reported 398 hours, 120 of which were focused on de-escalation through our use of force training, and there was also separate training for autism awareness. So again, we'll give you a running total for each month in those 2 areas. And in terms of staffing, I have 1 lieutenant and 1 officer on light duty, unfortunately injured on the job and requiring rotator cuff surgery. So the recovery time for that is several weeks. Hope to have them back in action sometime in April. And 1 additional officer out on injury leave, injured his hand while making an arrest. I'm hopeful to have him back by the end of the month. Otherwise, all sworn positions are full. I do have 1 dispatcher in training, and we have 1 vacancy in dispatch with a candidate just finishing up her background. We anticipate bringing her on board in April, and that will bring us to full strength in the dispatch center. Community service events. On February 7th, the community service officer met with library staff to discuss putting together a bicycle safety event for kids. We're anticipating having some type of bicycle safety rodeo late summer, early fall for the younger children. On February 10th, officers put on an ALICE civilian response to active shooter presentation to members of the senior center. Attendance was high, presentation was well received, and feedback was positive. February 21st, officers participated in the Special Olympics kickoff event at Mohegan Sun. Basically, this event recognizes the fundraising efforts of participating police departments, as well as discussing the torch run for the upcoming year. Officers in RHPD did really well this past year. They were recognized for being number 5 in the state for fundraising. They raised over $20,000 for the cause. On February 24th, School Resource Officer Keith Baker created a new community outreach with students from Mosier School. And the concept he came up with was coloring with a cop, something we hadn't done before. Students who were interested in taking part came to the art room and they chose a coloring sheet. Some of these sheets were police-related, some were not. During this time, officers sat with the students, interacted with them. The activity led to some great conversations between the officers and the students. And it was met with success. The demand from students wanting to attend was so high, they have now scheduled another date where they can have additional kids come and participate. You know, obviously, we'll try to get as many through as want to be involved. So kudos to the SROs there. terms of other reports, nothing to report on the Regional Auto Theft Task Force. February was quiet. They only went out, I believe, on 2 occasions, and nothing to report. No crime trends that we're seeing at the present. Happy to report no catalytic converter thefts for the month of February, so let's
God.
keep that going. And I believe that's all I have, unless there's any questions.
Council Sullivan.
Yep. Thank you, Chief. I appreciate the additional detail on the training hours, and I would like to keep
Okay.
that going month by month. You did mention there was a good number of training hours in those areas in January, but not in February. Was that because that's annual training once a year, or are we going to start seeing recurrence of that type of training in the course of the year?
So we have a 12-month training matrix, which lays out all the in-house training that we're going to provide, some of which is required for certification, some is above and beyond what we're required to do. So to answer your question, January was actually a combination. Autism awareness was mandated training. However, the de-escalation was training above and beyond what's required by the state. So it'll roll out differently each month depending on what we have planned, and we'll just report as we go through each month.
That'd be appreciated. Thank you.
Chief Cluster, you mentioned SROs, and at least like a couple of times a year we try to visit or revisit our situation here with SROs and how we are doing in terms of emergency preparedness in case we have a school emergency, God forbid. So I just wanted to kind of circle back from our conversation last year about where we are, and if you can give us a little bit of an insight into last time we had this conversation, I think it was early, spring. If you can talk a little bit about our preparedness in terms of SROs and school safety and response times and things like that, because also this topic has been a topic of discussion. There are a few bills out there at the General Assembly. I think there are at least 4 or 5 bills related to this topic, touching on different areas. But I think from our perspective, I think we want to touch on is emergency preparedness, and also in terms of how do you feel about our staffing levels are, and if they're adequate in terms of response times, if there happens to be an incident where we need to actually respond.
Okay. So, as we've discussed in the past, we have 5 schools in town, and we're presently running with 2 SROs. So obviously the time has to be distributed amongst the 5 schools. One of those officers is predominantly at the high school. We've targeted that as a priority area, whereas the second officer kind of spends his time amongst the remaining 4 schools. Now, I have asked in the past for 1 additional SRO. Funding being what it is, we understand, it'd be nice to have 1 in each school, but it's not realistic. As you're probably aware, we reached a little bit of a compromise this past school year. With discussions with the town, we were able to find some monies to provide some additional coverage. So in addition to those 2 full-time SROs, we have 4 hours a day, prime time hours, being covered by a 3rd SRO, which is basically a rotating police officer who splits the remaining 4 schools with the other SRO. So in terms of coverage, I'm very comfortable with the 2.5, if you will, as the other one isn't a full-time dedicated SRO, but works in conjunction with the SROs.
Right.
And between the 3 of them, we're able to, what has been identified the most critical need is arrivals and departures, where we have the most problems. And all of those are covered every day at all 5 schools with the 2.5. So I'm happy and satisfied with that staffing. And at the same time, we're saving a little money as well. In terms of preparedness, obviously events happen throughout the country. We learned from all of them. We trained with the SROs as well as regular officers routinely in-house, annually, I should say. in this area. We've mentioned in the past that the school has adopted the ALIS program and has individuals on staff in the school designated as trainers, so they train their staff. We've trained the officers, obviously, and we've taken a step further by training town staff as well. So I believe we have all the areas covered.
And you have a chain of command established. I know we talked about that last year as well. So
Internally, which extends out to regional if we have to. Absolutely.
great. I think that's all I got for the police side of things. Thank you, Chief Custer. Emergency management.
Thank you, sir. Good evening. COVID update, as of last Thursday, to 4.2 overall. For the state, we are running a little high at 7.1. We're the highest, as Charlie stated, of the 5 towns. We do have some test kits that are coming up on expiration in late April and early May. The directors will be advised on how to handle those. We're looking at a way of disposing of them because that becomes a problem. You can't just kind of throw them in the trash. Department updates. We had our first CERT meeting. We have 7 members. We have potential of 3 more. I've been in contact with them. We're still working on establishing a training program. We don't meet the threshold of 20 to have training come to us, so we'll be sending them out for training. Connecticut River Site Project, the NUCA project is the Geographic Response Strategies, GRS. And that's for any major events such as hazmat spills on the Connecticut River. Rocky Hill has been considered a priority site because of the boat launch and the ferry access. And again, due to the fact that we have access to the cove, Weathersfield Cove as well. Been working with the SROs. We had a meeting. We talked about upcoming events. They are going to keep me posted and get me a little bit more involved in school operations. So I've been working with Sergeant Carter on that. New statewide template came out for the local emergency management plan. Different ESF supports were added for mental health, domestic violence, and cybersecurity. So I've been working with Human Services on the mental health piece. PD has supplied me with some domestic violence guidelines, and cybersecurity, I'm working with IT. Other projects that are going on, quarterly workshop will be held May 11th. I'll be sending out a reminder at the beginning of next month. So everybody will have a month to prep. And again, same thing, we'll be reviewing the operations of the Emergency Operations Center, as well as roles and responsibilities. We just completed 2 of the 5 FEMA Advanced EMI courses at Fairfield University. That was last week. The next session will be on May 15th. The project, a lettering numbering project, has been completed. You may have seen coming into Town Hall, there's quite a few letters and numbers now on the exit and entry doors. So that project has been completed. I believe Facilities Management is working on a map with the building department so that we can get it out to all first responder agencies. That was supposed to go out last Friday, so in the report it says that it's been done, but I was informed this morning that it's still work in progress. We hope to have that out very shortly. Still continuing to work on the Remote Pilot 101 FAA drone to assist with fire and PD. There was one emergency activation, the concierge CO issue at 400, the 400 building up at the concierge, and we worked with fire, police, FMO, and EMS, Human Services, and Emergency Management to evaluate and assist if needed. Again, we were prepared if we had to take it to the next step, if there was going to be a large-scale evacuation. Buses were on the ready, and we were planning that out, and luckily we got everything taken care of within 2 to 3 hours. We had one weather-related notification went out in last month, and that was for the storm, the nor'easter, on March 14th. As you're all aware, we kind of got by without any major issues. Eversource and the utilities did have liaisons that called in, and we were working with them. I know that at the last meeting, Alice was requested a little update on Alice. Alice is going to continue to be supervised and updated through Sergeant Morgan and Lieutenant Phelps, but we did put the Alice acronym in there, and a little brief explanation. I know that some people wanted to know what Alice was about, so that is listed for you to take a look at. Any questions at this time?
Any questions, Council Salo?
None for me. Thank you, Steve.
Thank you.
None, I don't have any as well, so thank you, Steve.
Sure.
So I think we already did the new business. We don't have any old business, Mr. Town Manager, right? And so I'll take a motion to adjourn.
So moved?
Second? All in favor?
Aye.
Aye. Thank you.